AHS came forward with a 10-point plan, which we announced in earlier this year. At the same time, we announced the formation of the committee. The committee, one of my requests of the committee, and I want to thank them for their tremendous work in doing it, is to let's move quickly. So let's not wait for the full written reports. If there are suggestions we can improve the system, then let's actually hear them real time. Let's assess them to see if that we think that we can work, and then let's move forward with them. So that 10 recommendations that they've already we've been working on over the last number of weeks with the committee have already been approved, and that's what we're announcing today. There will be a report coming out which includes these 10 recommendations and others, because it's not only looking at shorter term actions that we can take, but also medium term and longer term. And then there's the report that's coming out is just an interim report. There's still more work to be done, and then will be a final report by the end of July. But what we wanted to do today is make the announcement, get these initial 10 recommendations that the committee has worked on, and get them actioned, because we have an issue now. We need to solve it now. And these actions will actually help add capacity to the system. So let's get going and try them out.
It means we're going to have dedicated vehicles with our dedicated professionals in our community, and that's very important. The concern has been that our ambulances are leaving our jurisdiction. This is going to make sure that we have our professionals in our community serving our people. So I want to thank the government for the innovation and for being open to this, and to our frontline staff who actually came up with this solution. And we're really excited by it. It's a step in the right direction.
We are heavily invested in this community and consider serving it our privilege. We've been losing this privilege since 2009, but today is a step towards refocusing on the needs of our community and the paramedics within it. It's also an opportunity to deliver on what our community expects from us, to respond quickly to our residents when they need us most. Operationally, we have the flexibility to leverage the efficiencies of our integrated model and its cross-trained firefighter paramedics to better serve the residents of our community. This pilot will repurpose the third person from our coveted 3-member ambulance model to staff 2 of these community response units. These units will be dedicated to emergency response within Strathcona County only. This shift allows us to direct our advanced care paramedics to the county's most acutely ill patients, provide them with an advanced life support physical assessment, and to ensure that they receive the appropriate level of treatment en route to the hospital. In the last number of years, system pressures have put a strain on both our professional and our personal lives. Frontline staff are tired, they're hurting, they're burning out, and many great practitioners have already left the profession entirely. This pilot is one opportunity to address the gaps in our community and will hopefully relieve some of the pressures in the short term.